Thank you for joining us today. My name is Keith Larson, and I serve as president of the Louisville Forum. The Forum meets on the second Wednesday of every month at Vincenzo's Restaurant in downtown Louisville. We are a nonprofit, nonpartisan public issues group founded in 1984. We host debates and discussions of current and sometimes controversial topics that affect the Louisville community. For more information or to become a member, please visit our website at louisvilleforum.org. Today's topic is finding answers for Louisville's homeless crisis. Just last Wednesday, homeless camps were cleared downtown. City officials said that the camps posed significant public health and public safety challenges. In August, to offer relief to these growing camps, the city announced plans to spend at least $3 million on a new safe outdoor space to provide shelter and food for those experiencing homelessness. The city has said that the new safe outdoor space could open next month. While some have praised the safe outdoor space as progress, others have been critical, saying the city's plan to move them violates their personal freedoms, and they would prefer the city spend its resources on safe, affordable housing. But even those who support using the safe space acknowledge it is not enough. While the outdoor space could accommodate 40 to 50 people, a 2020 HUD report identified more than 1,000 homeless individuals in Louisville in any given month. So what can and should we be doing as a community to move forward? What are the driving forces that are causing homelessness? Who is experiencing homelessness? What's working to help and what's not? Joining us today to unpack these issues, we have three speakers with different perspectives and a moderator to help facilitate our questions. Our first speaker will be Councilwoman Nicole George. In 2018, Nicole was elected to represent District 21 in Louisville's Metro Council. She is the chair of Metro Council's Public Works Committee and a member of the Budget, Parks, and Sustainability Committee, as well as the Public Safety Committee. Nicole has spent her career working with families to improve child safety and well-being. For over 15 years, Nicole has worked to deliver frontline services in child protection and has held an array of child welfare administrative roles. Our second speaker will be Natalie Harris. Harris joined the Coalition for the Homeless as executive director in 2010. Since then, she has helped Louisville initiate RX Housing, a program which has reduced homelessness among the chronically homeless, veterans, and young adults, as well as several community-wide education campaigns about homelessness and housing instability. Natalie serves as co-chair of the Kentucky Interagency Council on Homelessness and secretary for the Homeless and Housing Coalition of Kentucky. And our third speaker is Director Tameka Laird. In December 2019, Ms. Laird was appointed Director of Louisville Metro Office of Resilience and Community Services, or RCS. Having served in Louisville Metro government since 2005, Laird was inspired to join RCS because of the agency's work in fighting poverty, preventing homelessness, and promoting financial empowerment. She also serves as co-chair for the city's homelessness task force and as a board member for the Continuum of Care and Coalition for the Homeless. After our speakers make their opening remarks, we will have Bailey Loosemore with the Courier-Journal, who will be moderating and taking your questions. Bailey is a social justice reporter at the Courier-Journal. She played an integral role in covering last year's racial justice protests and was part of a team that received 2 Pulitzer Prize nominations for its work. So please join me now in welcoming, we'll begin with Councilwoman George. Thank you.
Thank you, Keith. It is an honor to be here with you today. I'm so excited to see so many people. So on Monday, I leave my house for a walk, and 1 block down the road, I meet a neighbor lying on the sidewalk. Her name is Milena. She tells me she's been out on the streets for a few weeks. She says she's from Bardstown and moved to Louisville to be with her boyfriend, and that she doesn't know a lot about social services, but she's ready to do something different. This is coming off Friday night, where I attended a community meeting at Colonial Oaks Apartments, an affordable housing complex, where I listened to neighbors describe the impact of living next to people who are unsheltered, staying in vacant spaces, and camping behind the complex. They reported being unable to let their children play outside safely and seeing unmet property maintenance needs as resources are expended to secure and repair damages. Property maintenance and residents are interested in organizing to make improvements. They express wanting to see neighbors housed while ensuring that it doesn't come at the cost of their safety and quality of life. Before I left the office yesterday, I heard from a business owner on Preston Highway. He's been on the corridor for 20 years. He described the challenges of doing business next to so many neighbors in crisis. He talked about the impact of having neighbors shelter behind his business and the challenges that come with trying to stay in business during a pandemic. This morning, I woke to an email about a neighbor concerned about someone who's been living on the porch of a Vietnamese grocery store for over a year. Someone saw the neighbor yesterday who appeared to be in crisis, having a behavioral health episode, and wanted to know about outreach efforts, not knowing that this neighbor has pervasive behavioral health needs and that there's been multiple attempts over the years to try and find solutions, that she's experienced years of trauma, disconnection, and global displacement. I share these accounts for 3 reasons. The first is that while I don't profess to be an expert in housing like my panel members, I am a professional social worker, and I do understand comprehensive community need. I can attest to the fact that the causes, the conditions, and the impact of homelessness is multifaceted and complex. We have community members on the streets for a variety of reasons, each of which warrant its own forum. We also have far more neighbors who are chronically housing insecure due to the cost of housing, the quality of conditions, and low wages. Categorizing all of these needs under the broad category of homelessness issues limits our understanding of what's needed for sustainable change. 2, I'm here because as a social worker and a council member, I am deeply concerned about those living in our community without shelter. But it also requires me to address the needs of all community members, including those most impacted by living next to neighbors who are unsupported and in crisis. If you're worried about those living on the street and our homeless population, you're probably also worried about the single mom who can't let her son play in the front yard because she lives 20 foot from an unsupported camp. Number 3, the reason why I shared the accounts I did is because there's a theme, and the theme is around change. You hear it in the thread of the accounts. In the 3 years that I've served on the council, I see progress in Metro every day. I see progress amongst our nonprofits, and I see a lot of promising practices. But I can also speak to the recognition I hear in the community about readiness for change and a willingness to do something different. And in the vein of doing something different, I'd like to share 2 strategies that I see as having transformational change in this moment. The first involves standardized decision-making around the relocation of camps. Under Director Laird, Metro has scaled up capabilities for both tracking and assessing risk as it relates to those living in public rights-of-ways, as well as those living close to neighbors sheltering in our public right-of-ways. My colleague, Councilman Arthur, and I have proposed an ordinance that would require standardized risk assessments be done on every camp within 10 business days, and that the findings from those assessments be used to drive decision-making around service provision and camp location. The second transformational change comes from investment. We have $340 million in unappropriated ARP funding. And in August, Metro Council established priorities via resolution for that funding. Homelessness and affordable housing was part of that in areas of concentration like transitional housing, large-scale permanent supportive housing, and of course, those services are to be directed at our lowest income neighbors and those impacted by COVID. Councilman Arthur sends his greetings today. He wanted me to remind everyone that we have a $5 billion gap when it comes to filling the affordable housing needs in Metro. I said $5 billion. That's a lot of money. And I say this to really hit on the magnitude and scale of the problems that we have and the limitations of our art funding. There's a subcommittee that's working on that I'm certain Director Laird will touch on in terms of drilling down those needs and how that money will be spent. But even with a significant allocation of art funding, we're only scratching the surface. I want to close by saying that we have some of the best people in Metro working in social services and in our housing advocacy community. We need commitments on housing itself, and I certainly support a housing first model. But I would be remiss if I didn't mention the fact that we need ongoing supports in the way of those providing service provision and funding strategies for those people. We need housing first, but not housing only. So with that, I will turn it over to my other panelists. Thank you.
So thank you. I am Natalie Harris with the Coalition for the Homeless, and I thought probably one of the most important things for me to do today, and something that we have not been able to do as well as normal times over the last however many months this has been, is to talk about the state of homelessness in our city. And so I will just tell you a little bit about the Coalition for the Homeless is the overarching agency that works with, we now have almost 40 different member agencies that serve homeless people in some way in our community, and hundreds of volunteers who do this work. Many of them are actually sitting amongst us here today, so thank you for that hard work. In this past year, we had on any given night just over 1,000 people that we know of that are part of the homeless, that have hit the homeless system in some way. So then the actual number was 1,013 when we counted this past year on any given night. And to give you a better understanding of that 1,000 people, 75% of them were indoors, were sleeping in some kind of a shelter facility, and 25% of them were outdoors. And that is an increase in the outdoor population. Over the full year, we had 8,745 people in our community, some for the entire year, some for a couple of nights, who were homeless in our community. And when you look at that group over the whole year, 63% of them were indoors the entire time. We also had 26% of those people who at some point during the year slept indoors for safety, and 11% of our homeless population never went indoors. So they were always outdoors. We have seen, and I know this may not be what you see when you drive downtown, but starting in 2010, and this is not just Louisville, but the country as a whole, that was the height of our homeless situation in this country. And each year since 2010, there has been a decrease in homelessness in our city and in the country. But in 2019, both the country and Louisville saw the first increase again in homelessness. So that improving economy had plateaued, and we started again to see more people falling into homelessness. In 2020, I suspect that would have been the same, but due to COVID, a lot of people jumped in Tameka Laird will talk to you about what the city did to repurpose funding so that especially families who were on a waiting list to get into shelter in our city, because we do not have enough family shelter, were quickly put into hotels and then moved into apartments. We got a priority with the Louisville Metro Housing Authority to get homeless people off the streets and into public housing. And so the numbers of homeless people actually decreased in 2020, but we also saw that that decrease came from the sheltered population, not from the street population. And as you can imagine, all of us are still worried about COVID. Congregate facilities made a lot of people nervous, and so we had less people in our shelters. There are a lot of things that cause homelessness. I thought Councilwoman George did a fantastic job of talking like there are so many things. But I think each of us know of people in our own lives who have mental illness, who have chemical dependency issues, who have health issues, and they don't become homeless. The common denominator of homeless people is a lack of resources. So they have those issues in their lives, and they do not have the personal or family resources to address that. And so that causes them to fall into homelessness, those deficiencies in our own systems. And the biggest of those are definitely housing. I talk about housing now the same way people talk about environmental issues. For every day we wake up and the environment is a little worse than it was yesterday. Every day we wake up and housing is a little worse than it was yesterday. But it doesn't get bad enough on any given day that we jump up to do something about it. And so for 3 decades, we have neglected housing. We have not invested in making sure the lowest income people in our country can afford housing and have that opportunity, and it just continues to build every day. We are now at the point of needing $5 billion to address that shortfall in our city, and it's going to take a long time to do that. Additionally, income and wealth. We are a very poor city, and so we have a lot of people in our city who make less than $16,000 a year. And you try to live on $16,000 a year and not at some point fall into homelessness. And so being able to equalize that income would be really helpful to those at the bottom end. And then our health system. We do not have a health system that immediately addresses the needs of the very low income. It works really well for some people, but if you don't have money, it is really hard to get the mental, physical, and chemical dependency type services that you need. And then add a pandemic. So on top of all of those needs that we saw that those who were already suffering suffered more. When you look at who was being evicted, even during the pandemic, 75% of those are black women in our city and across the country. That's who's the poorest in our city, and so that's who gets hit first. And many of those have children. Also, it was really hard to access federal resources. We were fortunate in Louisville. Our city put money into housing early, but they did that on their own. That was not because the federal government allocated money for eviction prevention. They took the money that came to the city and they allocated that. And we waited until almost a year after COVID started before any money was allocated to all these people who could not pay their rents. And so we are still trying to catch up and help those people. And nonprofits and foundations were also the first people to step up to keep people safe, to teach children in shelters, to everything that we all had to go home and do in our homes, that was happening in the shelter system. And I cannot thank the shelters in our city enough. They made their own PPE for months until that could be found. They stepped up to teach children and to make sure they could still get their schooling in shelter. They had to come up with new protocols. And much of this was coordinated through Resilience and Community Services, who with us had weekly meetings with all the homeless agencies to keep people safe. That went on to vaccinations and other things that happened as we moved through the system. So what do we need to do now? I want to close by saying that there are a lot of things that still need to be done, way more that can be done with the resources we have today. And so we need to start banking on these needs while there is unprecedented funding to make that possible. We need the service money for people who need that. So shelters and services, unfortunately, are necessary until we can make them unnecessary, and we need to make them a safe place for people to be. The city is already working on adding new beds, especially for families, but that will take time. And renovating some of the shelters to make them so that they're safer and more comfortable for people. We need money to take care of people when we get to the max, which we did in the last 2 years with CSBG money for hotels and emergencies outside of that shelter system. We need better access to our court system and to stop the evictions that just add to people becoming more and more fragile each time they get evicted. If we can prevent that from ever happening by making the court system more fair and making it easier to get outreach to people, to tell them what resources are out there, and a navigation system to help them through. I mean, if you got evicted tomorrow, would you know who to call and what you were supposed to do? There should be a single place where people can figure that out and somebody walks them through that system. We need that now. Right now, there are tons of people all working to address eviction in this city, but there is not one place you could call if you are afraid you have already gotten your eviction notice and you want to know where you are in line, when you might get money, what you're supposed to tell your landlord. There is not a single number you can call. We don't have that, and that should be something that is available to our citizens. And last, we need supportive housing and permanent housing to start toward that 31,000 units that we need for the lowest income people in our city. And I am excited about a lot of those other things that we're doing, but I ask all of you, we've been yelling and we'll keep yelling about the need for that housing. If you are willing to speak up with us, please go to louhomeless.org, our website, and right on the banner at the front, there is a way you can push a button and speak to your leaders about the need for affordable housing. We are asking for at least $100 million of the funds that are available to go toward that permanent housing, to make sure that people, so this is going to be, I think, the first time in my lifetime and probably the last time in my lifetime that we're going to have that kind of resource to try to finally make a dent. So I will just thank you all for this opportunity, and please join us in that call.
Hello? Hello, can you hear me now? Okay, let me get a little bit closer. Hi, my name is Tameka Laird, and I'm the Director for the Office of Resilience and Community Services. As you all know, you'll see an actual consistent theme between all of our actual presentations here today. And the consistent theme is homelessness. So first and foremost, I want to thank Keith. I want to thank the Louisville Forum and guests, fellow panelists, and the moderator, Belly Loosemore. It is an honor to participate today. In recent years, Louisville, like many cities across the nation, has seen a rise in our unsheltered homelessness. By unsheltered, I mean people living in places not suitable for habitation, such as our streets and our encampments. Resilience and Community Services, best known as RCS, has been the forefront of responding to this issue. Along with Louisville Metro government agencies, Metro Council, the Coalition for the Homeless, and numerous partners. I'm going to take you on a journey, guys. It's just like similar to what Councilman George talked about, but I'm going to do it from the perspective of the Office of Resilience and Community Services. So, but first, let's talk a little bit about what we're doing now and the reasons why. People become homeless for a myriad of reasons. You heard examples today from Councilman George and also from Natalie Harris. No two paths are the same, and there's no one-size-fits-all for any individual. But keep in mind, these subpopulations that we're seeing on the streets have evolved. We're looking at our elderly, our medically fragile, domestic violence, youth aging out of foster care, and reentry, and the increasing number of people suffering from substance use disorder or mental illness. The common denominator in all these groups is poverty. For at-risk populations, it only takes a small series of events to be without a home. Almost 40% of our Louisville households lack the basic personal safety net to keep them financially shocked, to keep them from having a financial shock or stressor. The households are liquid asset poor, meaning they lack the savings to make ends meet for 3 months at the poverty level and their income is interrupted. So what does that mean, guys? That means that everyone around this room, can you tell me or raise your hand if you have 3 months of emergency savings based off of your household income? So now think about that for a homeless person. Think about that for a person making $16K a year. The average person that we have out here in the population, we have over 58,000 households that are 30% area median income. That means equates to a 4-person who has only made salary of $32,000 a year. So think about that as we move forward. In another study, 26% of our respondents cited job loss as a primary cause of homelessness. As you have known, during this pandemic, it has exacerbated the overall efforts around job loss, around affordability, around those who are really in the actual trenches of poverty, and how they are working today and every day to actually climb out. Affordable housing remains the largest need. As you've heard from Councilman George and also Nicole Harris, we have a 31,000 unit that we need in our community. 31,000. That equates to $5 billion. Affordable housing remains the largest need. So how is the Office of Resilience and Community Services responding to this overall effort? Over the past few years, our work has evolved. The creation of the Homelessness Task Force in 2017, the launching of the city's unsheltered initiatives in 2019, in addition of the new Homeless Services Division added to our agency in 2021. Some of them are right here. The study, Solving Street Homelessness from Louisville that was released in 2019 guides our work. For you all who have not read it, I would advise you to do that. It tells you a little bit about what is going on in our city and what we need, and the recommendations that we're putting forth in overall efforts from the city to be able to mitigate. Through the Homelessness Task Force, the Unsheltered Homeless Initiatives, the Coalition for the Continuum of Care, Common Assessment Team, we're all coordinating and collaborating with partners even more than we've ever done before. I feel like every day when I reach out to Natalie, I reach out to her every day. So we are integrated. We are attached at the hip these days. What do you say? Okay. All right. Our goal is to meet individuals struggling with homelessness where they are. Outreach services are key in establishing critical relationships. There has been an incredible network of volunteers, professional outreach workers who provide boots on the ground to connect them to services and shelter. And recently, we explained outreach to, recently we expanded our outreach efforts by actually partnering with the Healing Place and then also 7 counties. Because we're focusing on peer support and meeting people where they are. We know that over 40% of our population that's on the street is affected by mental illness and substance abuse disorder. And of course, prevention is vital. I can't say more without talking about prevention. Since the onset of COVID, multiple agencies have provided rental assistance to over 30,000 residents impacted by the pandemic to help them remain in their homes. That number equates to about $50 million that has went out the door for assistance. The challenges of our houseless community are decades in the making. The HUD and Housing First model should be our focus, but funding has always been insufficient to meet the needs of our housing needs. Now, with the infusion of the city's $340 million that comes from the American Rescue Plan, we have an opportunity to make a significant investment in these areas. While funding is not enough to meet the overall housing needs, it can make a significant change or dent in our overall affordable housing. This last July, city leaders announced a 4-phase transition unsheltered from streets to suitable, sustainable housing. The proposal focuses on immediate, intermediate, and long-term solutions, including the safe outdoor space, hotel-motel model, permanent supportive housing, and affordable housing. We know there is no one-size-fits-all solution, so providing options is vital. We look forward to presenting further detail to Metro Council to seek approval on the best utilization of our ARP funding. In closure, I want to illustrate the challenges facing our homeless community. We know that our homeless is often transit, so we often see backpacks that they're carrying around with them. It usually has their belongings. It has food, blanket, clothing, supplies. Just recently, the Salvation Army, during the stand down with other organizations, distributed 600 backpacks with those essentials in it. Now think about other baggage that these individuals may be lugging around. When you add in trauma, poverty, the lack of support system, possibly addiction and mental illness, their backpacks are quickly being weighted down. As a community, we are working to create a coordinated system that can help lighten their load and provide support and hope. We need all of us working together, and when I say that, I mean that, together. Businesses, governments, not-for-profits, and volunteers to keep seeking solutions that will lead to bigger impacts in our community. And when I'm talking about impacts, I'm talking about the decrease in our homeless population. Because of the decrease, that means we're getting people into housing. So thank you.
Hello, I'm Bailey. I'm with the Courier-Journal. I just want to start by saying you all did a wonderful job of answering all of the questions that I had prepared. So I just wanted to start with Natalie Harris. You mentioned a group that has met through the pandemic to be very flexible in addressing housing insecurity and housing issues. Can you tell me more about that group and what gaps maybe it has identified and why collaboration is important to going forward?
Yeah, and actually, I wish I could tell you about a single group that has been meeting weekly since COVID started, but we have so many groups meeting weekly since COVID started that it would take a while to even list them. There's a group of people who all they do is street outreach. And they meet, now they're down to every other week. Most of these are every other week. They meet every other week to try to figure out who is most in need, who is most likely to die on the streets, and try to immediately address those people. There is a group that I think we're down to once a month now of all the shelters, of what they need and how we can get through the next step of COVID together. And then probably the group that would be most important to this is there is a group that is now every other week that meets about homeless eviction. or to prevent homelessness by preventing eviction. Part of that is doing outreach. We had volunteers, and now there is some funding to pay for staff who are going out. They have knocked on 3,000 doors in our community to try to prevent eviction. Our eviction level is way down, but it is still a really frustrating system to try to get to people before they're evicted. As Tameka was saying, to get that money that is available, but the line to get that money takes so long that we lose people along the way. And so that is a project we plan to continue, and to continue to try to save what benefits we've gotten during COVID, especially the work that the judges are doing in the courtrooms to make things more fair for people who are being evicted, by making sure that landlords cannot quickly evict them without first trying to get the money that is there for them. And so that work has been amazing. And legal aid, I'm trying to think of all the partners, anybody who is doing the rental assistance. It is a huge group of probably about 40 different partners. And it is one of the reasons, all of them working together, that Louisville is definitely on the forefront of getting that money out across the country.
Thank you. Switching to Tameka, I know that your office started a division of homelessness, or a homeless service division. I apologize. In January, what does that division entail, and how are you working with the community to make sure you're reaching everyone?
Thank you. So first and foremost, it's probably been about 2 years ago. It's all running together, guys. I'm moving from one thing to another. So about 2 years ago, we did a gap analysis based off of the need around homelessness, and also the capacity. As a city, our focus has always been homelessness, but not in the arena that we're in today. So as we built up more capacity, or not built up capacity, but built up more work that needed to be done around homelessness, we had to make sure we build capacity to do it. So this team that is, you'll see two of them over there right now, is our project manager, Tiffany McAfee. Would you please stand and say hello to everybody? And then also Kathleen Hartledge. She is our program manager, and a lot of you all know her through the business task force that we just created this month. So our overall efforts around this is actually trying to bring the community together, and then also look at best practices in our in other cities and states to bring them here and be able to utilize them in Louisville. And also looking at our peer cities, the ones that are equivalent as far as the size and population around homelessness, and then also citizens in our community. We know that by having this division, we can better be able to focus on the overall strategies and initiatives and gaps and barriers that we have within our homeless systems. Most of you all would look at the homeless systems and say, oh, they're broken. They're not necessarily broken, they are divided. So what we have to do is actually put them together and connect them. So this Homeless Services Division is focused on doing that. And by building those relationships and partnerships, and then also working with our homeless providers, and some of them are here today. Thank you, St. John's and Wayside. I see them over there. By having these partners here and also included in the conversation, we can better be able to put one step forward to be able to move another person into housing.
Thank you for that as well. Councilwoman George, you mentioned wraparound services and other resources that are needed on top of housing. Of course, getting people into housing is priority number one, but what do people need to be able to stay in that housing and thrive?
So in the community, we see a lot of neighbors who are in crisis. there is a response, whether it's from our nonprofits, from Metro and our outreach team. They get into housing, and then it comes with its own challenges. I think Director Laird did a good job of describing the backpacks and how folks are weighted down. And so, again, whether it's behavioral health needs in the way of addiction, mental health issues, it becomes a challenge for them to stay in their housing. And so one of the things that I'm really hoping that we see is that permanent supportive housing piece, so that folks have not only housing first, but they also have strong case management to work with them to stay in the housing, because what we see sometimes is it's just not enough to get into a space. It's really hard to, when you don't have the service array and you don't have the support system, to then stay indoors.
Gotcha. I see that you all have submitted a lot of questions, so we'll start with those. Homeless folks do not have a good source of information on COVID. How has the city responded to this educational need? So that can be maybe if we want to start with Tameka.
I think that's going to me. So basically, when the inception of the pandemic, we started all of the efforts of trying to make sure we communicate with the shelters and also with our outreach. So you would probably say that for a little bit, I became the one-man show of putting the actual meetings together and then working with the Coalition for the Homeless to make sure that we include all of our partners. So that became a weekly forum as far as check-ins with all the shelters, and then also with our outreach to provide updates. And then also looking at and monitoring the CDC guidelines around the actual shelters. As you know, we had to shelter in place. We had the 6 feet apart, and then we also had to wear masks. And so that came to the about of PPEs. A lot of our shelters at the initial stage did not have the funding for those PPEs. So we, as a city, started distributing PPEs. And so on a lot of occasions, you will see me out and about delivering boxes to our shelters. So it was all about what we needed to do within the pandemic to make sure that we can keep them functioning and operating. Our ultimate job is to make sure that they would not fail, because without our shelters, we will see more populations on the streets. So this pandemic and everything after has really brought all of our organizations together, and then also really working with our outreach groups to be able to convey that communication.
Thank you. I know this question says it's for you as well, but I think maybe Natalie might be able to answer it. The question is, could the Louisville Metro Office of Resilience and Community Service create and operate the one place to call for people facing eviction? I believe that there is a plan out there that the Coalition of the Homeless is involved in that has requested $20 million in American Rescue Plan funding, if you want to explain that.
Yes, so we have been meeting, like I said, for almost 2 years now. We support some form of this collaborative services so that there would be one place to call, one coordinated place where you didn't have to get bopped from one place to the other if that wasn't your need, but that was your need. And Louisville Urban League has been willing to come in as the lead of that, partnering with all the other agencies. There may be other proposals as well, but we hope that the city will fund one of those. I do also want to add that Tameka is not giving the city all the credit for what happened during COVID and what's still ongoing. There was an isolation center and still continues to be an isolation center for homeless people who have COVID, and it is still possible on any day at any given time, if you know somebody who has COVID or thinks that they may and is homeless, that they can walk into Phoenix Health Center and get a vaccination. There have been efforts to go out on the streets with the health department to do that, but just in case you know of people who need those services, please speak up and we will make sure they get to where they need to go.
Thank you. This one is for Tameka as well. You're getting a lot of questions here. So this one is a two-parter. I know it asks about the status of the safe outdoor space, which you did say hopefully next month. And then it asked about, as the camps were cleared, where did those folks go?
So the first question kind of answered for me, Bailey, okay? But I'll try to also add in some additional. So right now, as of the 17th, we received the applications for an operator. It's out now, it's closed. So it'll be going through the panel process. So the panel will reconvene, and then we'll have a selected operator of the SOS. We're hoping, this is aggressive market here around these ARP funding. Everything has to be obligated by 2024 and expended by 2026. So that's the reason why the city is moving so fast. Normally, we would have any project manager that knows PMP would say, we need time. But unfortunately, because of the nature of the beast and also the actual deadline to get these funds obligated, we're moving rapidly through this process. The second piece is dealing with, as far as a date, we are looking at November, but we all know that we have to have council's approval. So that is looking at this month for going through that process, but then we also have to work with the operator that's selected on actually outfitting that location. So November the 1st is aggressive, but so if we don't have any setbacks or issues, could be done, possibly maybe not. We're probably looking at December at the latest. The second question was dealing with where did these people go? Are you talking about the 6 to 8 block radius?
Yes.
Okay, thank you. So just last week, we cleared the 6 to 8 block radius of downtown. So it was great to see the overall effort and collaboration with our outreach groups. Wayside came out. I mean, there was so many people, organizations that came out to help assist us, and that was really a collaborative effort. But where did they go? So we had 17 that went into Wayside. Thank you, Nina. We had 4 that actually went to the Healing Place for remediation. So as you see, it works. Meeting people where they are works. Out of approximately up to 40 people that were out there, we got 21 in. So that's a win.
Thank you for clarifying that. This is a good question because it's asking, there is the mention of 31,000 units needed, but the number of people homeless or living on the streets or in shelters on any given day is only 1,000. So I think they're asking for clarification on what is that gap? What is the 31,000 number referring to? Not sure who wants to answer that, if anyone wants to take a stab.
Do you want to take it?
So the 31,000, and you, Tameka, talked about one report. I also encourage people, if you're interested in housing, to go to, all you have to do is Google Louisville Housing Needs Assessment. And it's a very comprehensive report, but the most important takeaway from that is that if we focused on people who make less than 30% of area median income, and that's a different amount depending upon how many people are in your household, but for a single person, we are talking somebody who makes $16,000 or less. And so if we could concentrate on housing or creating housing for that population alone, the other units would trickle up and we could address our housing crisis in the city. And we would need 31,000 units. That's the number of people making that little of income who are having to pay way over half of what they earn every month toward housing alone. Some of them, all of what they earn is going to housing. And so we need to make housing affordable for that group to address this crisis.
Kind of bouncing off that question, of course, the 1,000 number is the people who are visible. There are also people who, I guess, could be considered homeless but are not visible. You know, they're living, they're bunking up with family or friends, or moving around places because they can't afford to stay in any one place. I guess can you speak to that?
Yeah, we have less people who are not visible now, especially if you do the annual look. If you look at that 8,700, most people are going to hit the system at some point during a year. It's really hard in one night to find everybody who's out there, even if you know where they are, to find where they are that night. So that one night count is a lot less useful than the census for a whole year. But as Tameka was saying, the city has funded a huge increase in outreach. So you don't actually have to come into a shelter. Anyone that is hit by the outreach teams anytime during the year is also entered into the system and where they're progressing along that way. So we have fewer people, although we all know of people who have not gotten hit by the system in not just downtown, but throughout the city.
Thank you. I think this one can go for it says Natalie, but I think maybe Nicole could answer this as well, of how much does mental health preventative care impact homelessness?
I would say it's considerable, and by that I mean, first of all, it's what brings someone to crisis in addition to all the other factors when we talk about the lack of affordable housing, low wages. But I also want to say that what I see is the impact of what happens to someone the longer they're out on the streets. So we had a neighbor under 25 who had a housing voucher. We were trying to find him housing, and he was on the streets for at least 2 months. And being able to watch the condition of his behavioral health over the course of the months was really profound and significant. So I would say to anyone that, there's what brings someone to homelessness initially, but then there's what happens to you and the combined trauma of being out on the streets that is really huge, and why I hope we see a lot of efforts placed on prevention.
Gotcha. This person has a question about building tiny houses for people who are experiencing houselessness. I know that has been done in other cities. Is that something that Louisville is considering?
I'll take it, because I was like... we have actually considered all options. So we looked across the nation at best practices from everywhere. So we had a list. I think the list was around 20 of different options, because you have to remember that we have to move fast. So any option that we go with, we have to remember that it has to be created by 2026. So aggressiveness is the key here. That option was brought up, but you also have to remember you have to worry about the development codes in our city, as far as where could we set up, where could this actually be, and where it would be permitted. So that was all in consideration at looking at the options that the city went with. So our focus is always on short-term, mid-term, and long-term. We knew that we had to have a short-term solution right now because the crisis is happening right now. We also know that it needs to be built upon to actually be able to have different options that an actual person can have. Because, as you know, each homeless person is different. So the baggage and the barriers that they carry with them are different. So there is that everybody wants to focus on housing first, which is what we want, but we also know that there's a path that each individual has to take. So we have to be able to have options available for them to take that path. So that's the reason why you see the variety in the options, because we want to make sure that if they decide to take this path, it will lead to stabilization. And then after stabilization, then there will be some consideration of what choices do you want to have as far as going into housing. But as Councilman George and also Natalie Harris reverted to, is that there has to be support. Because a lot of these individuals are dealing with mental illness, severe mental illness. And some of you all came in contact with some of these individuals. So that gives you a prime example of what we're dealing with. So in that course, how can we be able to help them stabilize and meet them where they are? We have to be able to put them on that path that will lead to success for them. So that means that they also need support, wraparound support. And that's crucial with permanent supportive housing. That's the reason why we need so many units of permanent supportive housing, because of us dealing with, if you think about that 1,013 number, think about 40% or higher being affected by mental illness. So that puts you in the ballpark of about 500 people, right? So all of that 500 people need a little bit of help. not a little bit. Some are more, need more help than others. So that's the reason why wraparound services and supportive services is crucial. Case management is key for us in order to keep these individuals stabilized and housed.
One more question. I guess I would like to know from each of you, what do you think is holding Louisville back in addressing this? And do you think that Louisville is prepared now to really, I guess, make a drastic reduction in the homeless population?
So you heard me say on the front end that I do think that change is before us. I see it every day with the amazing team within RCS and with our nonprofits, and I hear the demand from the community that we have to do something different. I would say what holds us back is what holds us back in many ways, and that is full commitment, full investment, and being willing to try something different. Being willing, I'll be the first to say I've been somewhat skeptical of the safe outdoor space. I've done an evolution in my thinking and a willingness to try something that will provide another tool to the community. And so all that to be said, I would say commitment, investment, and a willingness to, to try something different and learn from that experience, even if it's not deemed an ultimate success and moving the needle.
I concur with Councilman George. I just want to add on a little bit more to that. Is our city ready? Well, I think our city is at the melting point. And when you think about the melting point, it's actually overflowed and now it's erupted. This is a perfect storm from us because of the pandemic, and it has exacerbated everything that's happened in our city, in our state, in our nation. So as we move forward, I say, yes, we're ready for change. I believe that all of you all are at a point that something needs to happen. And so thinking about these options, thinking about what we have available, we have $340 million. It's not $5 billion, guys, but it's $340 million. So if we invested in the right things, then we could see some really good impact and success. Also, from the point of dealing with other things that happen around us, we have to be vigilant of that, and we have to be responsive to that, right? Because we're all responsible for what happens in our city. So the onus cannot only be on the city to make change. It has to be on everyone. If you're vested, then we can be able to move forward. But it takes all of us working together to do that.
Thank you.
And I totally agree. So I don't have to be the one to say that the commitment, like being willing to really put what we need to put forward is there. But I would add something that I think is probably a surprise to most of you coming from me, which is one group that we have not talked about that has to be a part of this is our development community. And if we don't have them on board, then this can't happen. And if we are not supporting them, if they bring forward projects and they're willing to take the risk and not take the profit that they would get on the same unit that they could charge $1,200 a month for, and they're willing to charge $700, which is what our fair market rent is here, we've got to support those folks. We're going to need them to be able to build these units. And if they bring a project forward, we can't be voting it down after they've done all that work, because then they will not be committed to this work. So if you know a developer in this community who does this work and is willing to take on one project, we need them and we need you. And so I would say that's one other piece that we really need to make this work.
Thank you all. Thank you for having me.
Thank you, everybody, for joining us. This is a great program, great conversation, much-needed conversation, of course. Our next program is going to be November 10th. We do not have a topic, but we'll be sending an email about that soon. But we look forward to seeing you second Wednesday, November 10th, here at Vincenzo's, and we'll have information about our next topic. Thanks so much for coming out.